let's look at causes of zinc deficiency. There's several different ones. Some of them listed here: poor diet. So we talked about cereal. Cereal-rich diet is a poor diet. It's processed, especially the cereals today are so processed. I mean, processed, they have herbicides and pesticides added to them. Most of these sugars, or most of these cereals are super rich as well and have added sugars in them. We know sugar can deplete zinc and alter zinc metabolism. So poor diet, U.S., I would say we have a poor diet. We don't have a great diet here in the States unless you and your family are taking extreme measures, away from the standard grocery store to maintain health. Stress can deplete zinc. A diet high in phytates, as we said here, cereal-rich. Damage to the GI tract. So this could be celiac disease, Crohn's, ulcerative colitis. This could be gastritis or esophagitis, any itis of the gut that would affect the absorption. We've got candida overgrowth, can cause zinc deficiency. Alcohol, excessive calcium intake. One of the top recommendations, one of the only nutritional recommendations that we see coming from mainstream medicine is in women that have been diagnosed with bone loss through a bone scan, and they tell them what? They say, take calcium. And they tell them to take high levels, but do they ever measure their calcium levels? Typically never. One of the other things, I had, this is a true story, had an OB-GYN one time. We had the same patient, and the OB-GYN told my patient, she said, take Tums with calcium to get her calcium. Now, if you know anything about calcium absorption requires acid. You can't absorb it without stomach acid. Tums neutralizes stomach acid. So taking Tums with calcium is like taking no calcium. And you're neutralizing stomach acid. And when you neutralize stomach acid, you also reduce the ability to absorb zinc and magnesium and vitamin B12 and many other nutrients. So at any rate, and then genetic disease, as I mentioned earlier, showed you a picture of a young child, acrodermatitis enteropathica is one of the genetic disorders associated with zinc metabolism deficiency. Okay, let's look at some other things. So here's this research paper, a review on inhibitors and enhancers of zinc. See, various dietary factors can influence zinc absorption. We keep coming back to this phytic acid. I'm going to keep saying it. It's the principal dietary factor known to limit zinc bioavailability by strongly binding zinc in the gastrointestinal tract. So in your gut, if your diet is rich in cereal, phytates, or beans, this is legumes as well, you get zinc and you get a phytate, and they bind together, and then it makes it hard for that zinc to be absorbed into the bloodstream. And so you see here, it's the principal dietary factor. Principal meaning top, right? Not a minor factor, but a principal factor. Strongly binding zinc in the GI tract. Not weakly or meekly binding it, but strongly binding it. It's the major, so we know that phytate is the major phosphorus storage component in plant seeds. So if your diet is predominantly vegan, plant seed based, those chemicals, those phytates are going to bind. And it's not just zinc, it's other minerals as well, but it's going to make it very hard for zinc to be absorbed. So it's very important that you know that, because if you're staying on that kind of diet, no judgment from me, but it's very easy to ask a doctor to run your zinc levels and just make sure you're getting it absorbed properly, because zinc deficiency can create a lot of damaging problems. You see demographic and clinical characteristics of patients with zinc deficiency. This was a study done in Japan. It's a cross-sectional study using a nationwide Japanese claims database, identified several variables associated with zinc deficiency. So still talking about causes of zinc deficiency. So these variables included being an older adult, so being older, being a man or male, being an inpatient in a hospital, having comorbidities, meaning having more than one medical condition, such as respiratory infections, decubitus ulcers, pressure area, sarcopenia. How many elderly people do you know that are not adequately muscled? That's what sarcopenia means. It means age-related muscle loss, as well as chronic kidney disease. So these were the variable factors that all contributed to whether they caused the zinc deficiency or whether zinc deficiency caused these disorders. I think it's a little bit of both. You can also see additionally the use of certain medications, namely spironolactone, furosemide, thyroid hormones. So women, if you're taking thyroid medicines, ladies and gentlemen, if you're taking diuretics for your blood pressure, that's what furosemide is. Systemic antibacterial. So if you're IV antibiotics, maybe you had a surgery or maybe you just got out of the hospital. Corticosteroids. How many of you using anti-inflammatory corticosteroids? Many of you get injections in joints. Many of you are taking them orally. All these are associated with zinc deficiency as drivers, as driving forces behind causation. So if that's you, again, what's the theme? It's real easy to order a test. It's real easy to get the information. Let's look here. Zinc is essential not just for the surgery, but for the periods before and after surgery. You've heard me talk about surgery before. As a matter of fact, I've done entire shows on how to recover from surgery using nutrition. Zinc deficiency is associated with delayed bone healing. So if you've broken a bone, skin fragility, susceptibility to infection due to immunodepression. So if you're going under surgery, you're going to be taking some drugs, most likely, that are immunosuppressive already. Therefore, it has a significant impact on surgical outcomes. The author first became interested in the mechanism of bone healing in a case where an ankle fracture in a dialysis patient did not heal after 3 operations, and a zinc wave was later found in electron microscopy and electron probe X-ray, microanalysis of frozen sections of the ossified area of the yellow ligament. Subsequently, shoulder injections to a rheumatoid arthritis patient caused pyogenic arthritis, suggesting that low zinc levels in rheumatoid arthritis patients resulted in weak skin and low skin tenderness threshold. Later analysis showed that patients with zinc levels below 50 micrograms per deciliter, remember what I told you earlier, generally speaking, the reference range of normality is 60 to 120 micrograms per deciliter. They're saying that 50 micrograms per deciliter here died early due to infection, suggesting that low zinc levels are also related to poor immunity. 2 groups were compared after 2 months, after 6 months of supplementation with 34 milligrams of daily zinc to examine how much zinc should be supplemented by the time of joint replacement surgery. So if you've had joint replacement, hip replacement, those types, there was no significant difference in zinc levels in the 2 groups at 1 month before surgery, but at 7 days before surgery and 3 days after surgery. In the first group, zinc levels were significantly lower. Skin necrosis occurred in 3 cases, and skin healing was delayed in 4. So this is where it's really important when you're thinking about supplementation with zinc. Maybe you have a pre-scheduled surgery coming up. Hopefully it's pre-scheduled and not an emergency. That's terrible, but at least 1 week before, and I recommend 8 weeks post, as well as during. So if you're in the hospital, take your zinc with you. The problem many people run into with surgery is doctors don't understand nutrition. So the standard protocol when you're going into surgery, doctors will say, discontinue all supplements. In other words, be off of everything before, 1 week before surgery, during surgery, and even up to a week after surgery, but it's discontinue all supplements. This is bad advice, by the way. This is actually, in my opinion, it's medical neglect. Any person going into surgery should be having a micronutrient analysis to assess their nutritional status so that they can effectively be supplemented to improve the outcome of the surgery and to reduce the potential risk for infection and other complications. Not discontinue everything because we don't know anything about it. Why do they want you to discontinue supplements? They're worried about bleeding. And certain supplements will cause kind of a thinning effect on the blood. Predominantly things like ginkgo, I don't know if you've ever taken ginkgo biloba. Vitamin E has a thinning-like effect. Some try to say that omega-3 can have, but it doesn't really. Omega-3 really doesn't thin the blood in the way that would cause a surgical complication. But the advice is still to discontinue all supplements. And so if you're going into that surgery with a zinc deficiency, as I showed you before, skin fragility, reduction of bone healing, increased risk for infectious complications, it's just bad advice. And I would highly recommend that you have a conversation with your surgeon, with your doctor, if you've got a pre-scheduled surgery, because nutrition is going to make or break the difference in whether you have a good recovery or not. Now we also have effects of dietary glucose and fructose on copper, iron, and zinc metabolism in humans. So our results suggest sugar consumption affects copper and zinc metabolism parameters within 2 weeks. Alterations in transition metal metabolism in turn can contribute to aberrant fuel utilization and worsen metabolically related diseases. Now, how many of you going into, if we're talking about surgery, how many of you also have like a blood sugar problem or have been diagnosed with metabolic disease, like metabolic syndrome, high blood sugar, high blood pressure, etc., and your diet's rich in sugar, right? And now you're pushing out your zinc and altering your zinc and copper metabolism, which can exacerbate the blood sugar problems. So our findings are the first evidence that consumption of sugar-sweetened beverage can alter clinical parameters of transition metal metabolism in healthy subjects. So this is done in healthy people. This is not even done in sick people, but this is just giving healthy people sugary beverages and watching their zinc metabolism and copper metabolism tank. The average American, the average person living in an industrialized country isn't healthy. I mean, we could argue that they're not healthy. They have prediabetes. I mean, you look at America itself, it's like 70+% of the population is overweight with some level of metabolic syndrome. You take that, and then you take what we just said about surgery. So in the hospital, this happened recently when I was advocating for someone in the hospital. What did they bring? They were feeding this product right here. Go look up this product if you'd like at the grocery store, but this is a protein supplement product. This was after a surgery. Number one ingredient, sugar. It's a terrible product. It shouldn't be allowed in hospitals. It should be classified as a human poison, and it should be banned from sale in the U.S. But this is what hospitals are feeding post-surgical patients. So you take what I just said about zinc, and that zinc deficiency can contribute to failure for surgical recovery to occur, and then you're going to take a product like this loaded with sugar and feed it to a person who's just had surgery and potentially wreck their capacity to heal and repair from the surgery. Hospitals should pay much more close attention to the nutrition that they're serving up.